Welcome to the Osteopathic YouTube channel. Today I'm going to be talking about why do we get pain around the back of the pelvis. So normally I would be joined by the lovely Oliver. He's not here today as he's not feeling 100%, so I am going to be covering for him. So the most common conditions that we see in clinic day to day, number one is sacroiliac joint capsulitis, or pain around the SI joint. Your SI joint around the back of the pelvis is responsible for rotation and movement through the pelvis as we're moving. What can happen if we're suddenly bending or twisting or leaning in an awkward position is it can become incredibly painful over that joint, and it is typically the capsule around the joint that's really pain sensitive. How people present is very specific unilateral pain around the back of the pelvis. What they can also get is referral because of the pain receptors in the capsule down into the glutes, into the hamstrings and down the back of the leg, which is why sometimes it can look or mimic symptoms of sciatica, but actually on testing a lot more specific. So what we would want to do as osteopaths is getting the area moving, taking away any tightness around the joint and take away any compensations where the body has twisted into that position. Number two, the second thing that can refer pain here very commonly is linking back to the lower back conditions that we've looked at previously. So disc injuries, any facet lot or capsulitis into the joints of the lower back can also refer down into the buttocks, back of pelvis and down into the leg, depending on the level. So sometimes we can see that referral down into the back of the pelvis as well. What we also find, number three, is trigger points or tightness into the glutes. So any pain and tightness into your glute muscles can give quite specific pain, but can also refer down the back of the leg. What we would want to have a look at, if there are trigger points, which are tiny little knots in the muscle, as osteopaths you want to work to release through that area, so potentially a bit of soft tissue, a bit of inhibition, relaxing around that area, but also thinking, why am I getting pressure through this point? Is it that this person is dropping and twisting during the day, so loading more through that side? Have they suddenly picked up a sport, which is incredibly common during lockdown, that's loading more through the pelvis and causing the pain? So yes, we want to work on the site of pain, but we also want to look a little bit more global to get the pelvis and the body moving.